Dr. T. Badrinarayana, cardiologist from Apollo Hospital. Want to speak on something on the COVID-19, which is going on as a pandemic, affecting the more than 200 countries, taking a lot of lives and also morbidity, and losing the working hours and as well, losing an economic loss throughout the world. It become a problem individually for a nation as a global. As raised by India International Monetary Organization also, they are very concerned. As a clinician, I'm still apprehensive when the drugs will come. But a recent news has come, the drug has come from Israel, which is promise, looks like a promising. It may be helpful throughout the world. At the same time, it is very important on the part of individual and state and country, the detection, area of detection, mode of detection should be so fast so people can be detected early and they can be treated early, so there will be a good prognosis. At the same time, the nation should take interest to find out a vaccination, at the same time other modalities of treatment. As for individual responsibility, they should maintain hand cleanliness, cleaning the hands with alcohol-based sanitizers for 20 seconds per minute, and closing the mouth, not touching eyes and nose. So we shortly say people should avoid to touch men, M-E-N. Men means mouth, I-E means eyes, and means nose. So the individual can protect himself. How can he help for the society? He can maintain social distancing. He should not invite unnecessary gathering in their house, and he should not attend the social functions, so that he will not spread the coronavirus affecting the society. Similarly, as a nation responsibility, they should also create awareness among the people, those who are not educated. And every individual is responsible to take care of himself as the state, as the nation at large. Now we go to the cardiologist point of view. Initially, we thought coronavirus only affecting mainly respiratory system. Gradually, it is seen it is also affecting the cardiovascular system. Patient presenting with chest pain like angina, also acute coronary syndromes like acute ST elevated MI, non-ST elevated MI, and in that juncture, it is very difficult to detect whether the atherosclerotic or affected by coronavirus. So, as usual in emergency room after triaging, straightway you have to all the maintaining doing the coronary angiogram. If normal coronary is maintained like corona affection, or is an ST elevated deal with the atherosclerotic coronary disease. Studies found that coronavirus affecting heart disease or normal presenting with cardiovascular disease, the mortality is increased by 20%. But what to do? When the patient comes with acute coronary syndrome, you have to deal. You have to save the life by whatever the available interventions. And this 20% gradually, once the expertise improve, I think the prognosis will improve, one thing. Second, during procedures, we have to take personal protection equipments very well and do the without fear. You have to do the procedure, then you look for the prognosis. But other drugs like antiplatelet statins you should use. And there is a concern to use of ACE inhibitors ARB. But gradually studies prove that there no much difference with the use or not. But the present scenario, few studies they say not to start with ACE inhibitor ARB, but patient is already ACE inhibitor ARB, you should continue it. This is one, already it is clear from all our studies. So the cardiovascular effect of corona somato is there. In a patient of cardiovascular disease, if corona infection occurs, it creates a high mortality, especially in presence of hypertension, diabetes, old age above 60 years. It is proven throughout the world. So elderly population with comorbid conditions, they should more strict this social distancing, other measures not to be affected by corona. Okay, thank you.